watching AYV Television.
Good evening, viewers, and welcome to another episode of The Woman's Place, your weekly women's health program coming to you live on Channel 33 AYV Television. I am your host, Dr. Frances Ramatu-Wuri-Sise, obstetrician gynecologist. Remember that we are streaming live on www.ayvnews.com and that our Facebook page at The Woman's Place is looking forward to receiving your questions and comments. Tonight, you can call us on 025-271-959 as we look forward to taking your questions, comments later on in the show. Our topic for tonight is breast cancer. Breast Cancer Awareness Month is marked in countries around the world every October in a bid to help increase attention and support for greater awareness, promote early detection and treatment, as well as palliative care of the disease. Breast cancer is by far the most common cancer in women worldwide, both in the developed and developing countries, accounting for about 25% of all cases. Statistics show that in 2018, there were about 2 million new cases and 627,000 deaths. With me this evening, I have Dr. Constance Cummings-John, surgeon specialist, attached to the University of Sierra Leone Teaching Complex at the Connaught Hospital. Please say good evening to our viewers, Dr. Cummings-John.
Good evening, viewers.
I also have with me Dr. Essie Donna Thomas-Macauley, clinical and medical director at the Well Woman Clinic in Freetown. Doctor, please say good evening to our viewers.
Good evening, viewers.
Okay, so I'm going to start with you, Dr. Thomas-Macauley. What is the significance of Breast Cancer Awareness Month?
October, right throughout the globe, is celebrated as the month to raise the awareness for breast cancer. Mm-hmm. It helps to encourage people to understand the impact that it has in the lives of women and men as well, and to help increase the understanding of why it's necessary to increase prevention, opportunities for screening, and opportunities in dealing with people undergoing palliative care.
That's true. And it's also important with regards to fundraising because, I mean, management is very expensive.
That's when we work
hard. Exactly. Yeah. So, yes. So thank you, Dr. Thomas-Macauley. Dr. Cummings-John, so we hear a lot about cancer. Can you tell us what it means in general terms and also with regards to breast cancer? What do we mean when we say cancer?
Okay. Generally speaking, cancer means abnormal growth of cells. Abnormal in the sense that those cells in the body, because every part of the human body is made up of tiny particles known as cells. And when these cells no longer undergo the proper division that they're supposed to undergo, they become cancerous. And at that, they can spread to other parts of the body, and they can have a devastating effect on the whole general well-being of the person. And specifically, breast cancer is just talking about abnormal growth of breast cells. And those cells are now dividing, and they are not under the usual control of the body. And they can also spread to other parts of the body, like the lungs, the brain, and have devastating effect on the person as a whole.
Okay, that's good. You've kind of gone ahead, but we'll talk about that later. But thank you. So in general, the Sierra Leone Cancer Registry records number of cases annually, and obviously we have different bodies also recording cancer cases in different countries. What are the latest statistics when it comes to breast cancer?
Okay. With the advent of new cases of cancer coming up, then it was definitely wise for the cancer registry to be there for Sierra Leone. And in 2014, according to WHO, the number of cases of breast cancer, constituted about 21%. However, the global, there's a study, a global cancer study, which collects data from worldwide data. And according to that data, the number of cases of breast cancer in Sierra Leone has risen up to 27%. So those are some of the statistics and the figure we have regarding breast cancer in Sierra Leone.
And for sure, I mean, if we're thinking about comparison, I mean, mostly we talk about cervical cancer most of the time, right? But now we find out that breast cancer accounts for the highest number of cancer cases and also the highest number of deaths. So as much as cervical cancer is very important, we definitely should be raising the awareness when it comes to breast cancer. Which age groups are likely to be affected?
Well, we usually see cases of breast cancer increasing from 30 years upwards, but that doesn't mean it doesn't occur in ages below. We've had a case that we're treating now for a 22-year-old woman, and Dr. Issy was just telling me of a 9-year-old girl, and these are diagnoses that have been proven by histology. We tells you, so it's there, even though it's quite rare along those age group, but it's quite common from 30 going upwards to 50, and then we can probably see a gradual decline, but it's on the increase. 50. Yes. As the age from 30 years upwards. Okay.
So Dr. Thomas-Macauley, obviously I mentioned that you work at the Aberdeen Women's Center. Sorry, you work at Well Women Clinic, yes. And you see a wide range of patients when it comes to breast cancer in different stages, or people with just breast abnormality, let me say it like that. When we're talking about breast cancer, which symptoms usually do patients present with? That's the first part of the question. And then also, what do we want women out there who are watching us to be looking out for as they do their, they live their daily lives? What should they be looking for?
When it comes down to abnormalities, most women would not particularly come up with the word pain.
Okay.
But they'll probably have palpated, meaning feel something abnormal within their breast tissue, maybe accidentally. Sometimes the husband finds it out, or the boyfriend, and then, or the parent, and then ask about us just screening, and through the screening protocol, we get to find out with detailed assessment what it means in terms of the pathology. But pathology, when significant or when worrying, means somehow it includes a lump that would involve this underlying skin tissue, or even showing on the skin tissue. So it's highly important when you have any lesion or mass palpated or felt on your breast that you do go and see a doctor and don't start trying to treat it yourself or going into a pharmacy just to pick up any drug.
Good point.
It's very important.
Good point. Dr. Cummings-John, can you come in there? Like, what other symptoms usually do these women present with?
Okay. So with regards to breast cancer, as I said, it's abnormal growth of cells. So usually they'll feel a breast mass. They'll feel something hard in their breast. Can also present with skin changes as well. You have what's known as pudor orange, and that looks like the skin of an orange. So when you have those kind of thing you notice in your breast, ulcers, because these are how women in our society usually present, and those are signs of like advanced disease. They might also feel a lump under their armpits, which shows you there's an axillary swelling. So these are all the signs that they will present with, but most commonly present as a lump in your breast that is painful and is also increasing in size, with changes in your skin and your nipple, with possibly discharge from the nipple as well. So that's also associated symptoms that they can present with.
That's a good point with regards to just discharge. So we want to make sure that they're looking out for which kind of discharge should they be looking out for?
Well, sometimes they come as a plain color, meaning it could have a yellowish color, a brown, a reddish color, sometimes with smell, sometimes without smell. What's important is when you see the consistency of your nipple discharge. If you've never had a nipple discharge, you go see a physician to get it examined.
That's true. I'm going to go back to you, sorry, Dr. Thomas-Macauley. When it comes to Well Women Clinic, like I said, you see a wide array of patients. What's the statistics that you see at Well Women Clinic when it comes to breast cancer? Because I know that's a huge advocacy group when it comes to management of patients with breast cancer.
Well Women Clinic has been established for over 13 years. So we've seen over 50,000 women.
That's a lot.
Yeah. Okay. Now, let's say from 2017, our percentage was over 50% of the women that we found were more abnormal cases, compared to about 47 that were normal. And by 2018, that has slowly, kind of, gradually turned over. Now we have about 47% of our cases seen
are Abnormal?
Abnormal, and
okay.
that's based on those who actually go get their test done and come back with their report. So those that we lose into the community,
don't know what's happening with them.
We don't know what happened with them.
Right.
And then of this year, that has slowly improved because with the amount of awareness that we've been putting out, our outreach, going out to communities, preaching to people. We have a lot of people coming in now for early screening, early detection. So we're doing.
Let's talk about that, the outreach program. What exactly, how are those conducted?
We do quite often, several times during the course of the year, go into separate communities, sometimes out of Freetown, and depending on how much funding we have available. And we sometimes go into school, to offices, we go have a talk with people, and then we encourage those who have issues or who know of someone who have issues to come forth, and we do free screening and free examination. And through that, anyone that seemed to have a lump that we're not happy with,
then you can follow through.
We ask them to come into the clinic and get further examination.
Oh, that's good. Dr. Cummings-John, a lot of people, we've just talked about what symptoms patients usually present with. A lump, maybe some redness, whatever the case may be. But not all of these are cancerous. Not all of these are malignant. So kindly take us through some non-cancerous or benign breast conditions.
Okay. Usually benign condition I usually see in younger women. So women less than 30 in their 20s. There's a high chance that whatever lump they will have, most times, it doesn't mean it all the time, but it is most times benign.
Right.
The lumps are usually not hard, as you'll find in a cancerous mass. They usually are not attached to the skin or the underlying muscle.
Right.
They're usually quite movable. We usually call them breast cells. They're quite freely mobile.
Okay.
And they do not cause pain.
Right.
And usually they do not increase in size.
Okay.
So it's usually the same. You'll notice the same lump being there for months without noticing any change in its size or the change in the surrounding skin. So usually from clinical examination, those are benign lumps. But however, ideally for any woman, if you feel any lump, it's actually ideal you go to a professional to actually rule that that's lump isn't a malignant, because only through tests then we can be able to be so sure that it's not a malignant lump we're dealing with.
That's a good point. But obviously, I find that with benign conditions, usually it's kind of more difficult to treat when it comes than cancerous, in the sense the psychological what should I say, warfare the patients have with themselves. Can you talk a bit about them?
Yes, it's quite worrisome for any woman.
Right.
Today I saw a patient who had actually had, she's a young girl in SS4. She had actually been to World Woman Clinic, she'd done everything, she had the reassurance, even had the cytology done, which it wasn't malignant. But actually and she was told to just observe the lump.
Exactly, that's
and
the
then
most
she came back again, that's like 10 months down the way, and she came back and the mom was, well, we've been observing this lump, and as the mother, I had the lump removed when I was 16 years old. So I want to have something done for the lump. I was like, okay, then we'll arrange for her to have an excision biopsy done, and then we can send to the lab. So, but most women, you're quite worried, especially if you have a family history and you're quite bothered with something being in your breast. So definitely you want up to have the surgery done, and then yes, it can be done in those cases.
Yeah, thank you. Yes, you want to come in? Yeah.
Quite a lot of the cases, as you say, that we get below 30, and especially if that woman is newly paired, she's never had a child before, we kind of encourage them based on the statistics that they kind of like outweigh a period. So a lot of counseling, we ask them to come in for like follow-up ultrasound and just follow up the if necessary, we do an FNAC at some point.
Explain
and basically,
what is FNAC?
An FNAC means a fine needle aspiration. It's just a small bit of an examination where you put a little tiny needle into the lump, take a tissue out and put it under the microscope so we get a more accurate analysis of what we're talking about. This is something that's done in split seconds, and we confidently do it while you're just looking at us. You don't need to be sedated, so it's very comforting. What's important is these lumps, we try to encourage a lot of women who've not had kids yet to go as much as possible, especially if it's not showing, if it's not bulging out. So because the scar tissue, and we have a lot of people with keloid skin, you know, proud flesh. So for people like that, especially a tendency of having that in the family, we tend to see how best we can postpone surgery, so further notice, in the interest of, you know, cosmetic purposes.
Okay. Well, you've started actually talking about it, but next we're going to talk about risk factors. Now, because there aren't no known causes per se, like you don't have like a direct association with certain things when it comes to breast cancer, but then there are risk factors. If you have this, or if your lifestyle is this, you're more likely to have it. So let's talk about the risk factors, Dr. Cummings-John.
Okay, so breast cancer, we start by sex. It actually, your sex as a woman puts you at increased risk. It doesn't mean it doesn't occur in men.
Right.
So it's less than 1%, but it does occur more in women.
Right.
And then we also mentioned the age. As the age
Right.
increases, there is an increased risk. And then family history. Women who have known, especially with first-degree relatives, meaning if your mother, your sister, your aunt, or grandmother has had history of a breast cancer, then there is the increased risk for you as well. And then some people, it's genetic. They have abnormalities within their genes. Usually, it does constitute about 5% of the population, but it does occur. In some people, there is a genetic predisposition to have breast cancer. And then there are certain other factors, endocrine factors as well, factors that have to do with your hormone. So if you started seeing your period quite early and you get to menopause quite late, you have that long time of exposure to estrogen, then those are all risk factors. And then also environmental factors like what we eat, obesity, alcohol, smoking. These are all factors that can also increase your chances of having breast cancer.
And contraceptives?
Well, yes, for a longer period of time. If you've used it for over 5 years for a prolonged period.
Now we're talking about combined oral. Let's be specific, eh? We're
yes,
talking about
if you've used it for a long time, then there's an increased risk there.
Okay. So definitely.
Also one factor,
yes,
if you don't mind. Women who tend to bleach their skin because of the exposure of the dermis, and for people like that, there's a lot of education that needs to be taken place now within the community.
Carcinogens.
Yes, exactly, because a lot of these creams that we do ship into the country, they're not being controlled, and they have certain chemicals in them, and the side effects of you taking off the layer of your skin, exposing the inner layer of your skin, that's basically putting your body generally at risk. So that's not even just breast cancer, but
the skin
cancer.
Exactly. Yes. So I think the message we want to get across is that there are certain things that women and men, because I mean, as you've mentioned, breast cancer is not only particular to women. It just happens that with men, they have less breast tissue, and maybe all of these things that we're talking about with regards to redness, swelling, and all the rest of it may present later. So I think the statistics show that men present with more like later stages, right,
yes,
of breast cancer.
Yeah. Yes.
So because of those things. So it's really important that we know what to look for, or we identify the risk factors amongst us, so that we know that we're at high risk and take preventive measures. Dr. Cummings-John, again, how do we make a diagnosis? A woman comes into a clinic, she comes in and she complains of swelling for 6 months, she has bloody discharge, nipple discharge. What do you do?
Okay, basically for breast cancer, we have breast lesions. We have what is known as the triple therapy, triple investigation. So we want to do from your clinical examination by just looking at the mass, feeling it, looking at the changes in your breast. If there are any swelling in the axilla, clinical examination, it also gives us a clue that whether we're dealing with something that is benign or malignant. And then we have radiological investigations that help us to know further, like our ultrasound scan, mammography. Those are investigations that we do that help us to give an indication of what type of lesion it is in the breast, and can also give you. But the definite diagnosis is from the histology. So that we can, as Dr. Ese has mentioned earlier about the biopsy, fine needle biopsy, or we can do a 3-cut biopsy, or we excise the sample of itself and then send it to the lab.
Okay.
And those 3 investigations all combined can give you a definite diagnosis as to whether the lesion you're dealing with is malignant
or benign.
Yeah.
Thank you. Dr. Thomas-Macauley, we've talked about Well Woman Clinic with regard to their contribution when it comes to breast cancer. When it comes to diagnostics, how does Well Woman Clinic contribute?
As she's basically interpreted all what we are responsible for.
Yeah.
Because when a patient comes in, they do a full clinical history check based on your background and what your findings are. So if you're just there for screening, they screen you and then you're off if nothing's found. But if there's a lump that's detected, we normally would send you to follow up depending on what age you come in with. So any woman that walks in under age 40, the first line of diagnosis would be ultrasound.
Right.
Okay, after clinical evaluation.
Under 40 years
Under
old.
40 years,
Yeah.
that's the international protocol.
Right.
Now, if you're over 40, the first line of diagnosis should be a mammogram. And whether or not you've had one, as long as you've met childbearing age, we highly recommend that you do go get a mammogram. We call it a baseline mammogram.
Right, right.
And both breasts, because we need to compare both breasts.
Right. Not
And
just the one you have issues with.
exactly.
Okay.
And even if you don't have any, if you have had symptoms, you've got complaints, not necessarily a lump is felt, because there are certain cancers that are not basically identifiable by a lump.
Right.
So it's very necessary. A woman at around age 40, if you, especially you've had kids, or in your later part, if you have symptomatic issues, or you have people in your family that has reported with breast cancer, we do send you for a mammogram. And then based on the outcome, the decision would be to follow up with either, as she said, a fine needle aspiration, which is a smear test, and cytology test, or follow up by taking it out and then putting it again as a whole tissue under the microscope. Or in certain cases, we would decide whether or not it's a wait and follow up after that.
All right. Okay, viewers, remember you're watching The Woman's Place live on AYV Television, channel 33. We are also streaming live on ayvnews.com. You can go to our Facebook page at The Woman's Place and leave your comments or questions. You can also call us on 025-271-959. We are going to take a short break, and we will be back after these messages.
AYV Television.
West Coast of Freetown.
Good morning and welcome to the weekend. That's for you. A new venture.
Next time in Freetown, where it is
Conducts across the country.
Welcome back to The Woman's Place on AYV Television, channel 33. I am your host, Dr. Frances Ramatuwori Sise. Our topic for today is breast cancer. I have with me in the studio Dr. Constance Cummings-John, who is a surgeon specialist attached to the Connaught Hospital Teaching Complex. And I also have Dr. Essie Thomas-Macauley, who is the clinical director at the Well Woman Clinic in Mooretown. We've been discussing breast cancer in general. We've talked about statistics. We've talked about some risk factors, the people who are most affected. We've talked about the work that Well Woman Clinic has been doing when it comes to the management of these patients. Now we're going to talk about preventative strategies. We've gone over the risk factors, and we know that we are basically advising people out there, if you are, what should I say, practicing certain lifestyle, or if you know you have a family history, you should be more cautious when it comes to breast cancer. So what preventative strategies should women employ? Let's start with Dr. Cummings-John.
Basically, preventing breast cancer, the key is to detect early detection.
Right.
So key to every woman is self-breast examination, which is done on a monthly basis. As soon as you've finished your menstrual period, then you can examine both breasts, looking for any irregularity, any new mass, any growth within the axilla. And also quite important is that there are other factors that you really can't modify. If you have a known family history, being a woman, and have a family who has breast cancer. So all you can do is just to ensure that you do self-breast examination to make sure you detect the disease in its early stage when it can be treated.
Right. So
and
you
then
just
modify
mentioned
some factors like smoking, alcohol, weight control. These are quite essential for a modern woman to avoid such things, because they actually lower your risk of not only breast cancer but other cancers as well.
So basically we're saying that there are certain things you can change, and there are certain things you can't change. So then take it upon yourself to make sure that the things that you can change, you work on those things when we're talking about that. So she mentioned self-breast exam that women basically, after puberty are advised to do on a monthly basis. Take us through that, Dr. Macauley.
Now, with self-breast examination, we highly recommend both men and women to basically, first in a lying position, use your forefinger, just this fork part, and gently press it by, first of all, lift. If you're doing the left breast first, you lift your left arm above your head in a lying position. You take your forearm and then you press it gently but intensely against your chest wall, and you start from outside or from your clavicle. Say, take the clock face, okay?
Go around.
You have a 12 o'clock position. You start at the 12 o'clock position and slowly down towards your nipple, and then you take 1 o'clock, or you move towards the 1 o'clock position. And also don't forget to palpate, meaning touch, press, under your armpit, which is very important because if there's any lesion there and you miss it, that could be a key value in helping the doctor understanding your status or how urgent it is. So you need to do that right around your breast, and when you're finished doing it in a lying position, you make sure you sit up and do the same thing. To make it easy for a lot of people when sitting up, or I would suggest also do it in the bathroom when you're having a shower.
When
with
the skin's wet?
Yes, when your skin's wet, with a bit of soap, so you have slip. And that's quite easy for you to go, but just take your time so that you don't miss any angle. Take it from outside in, not the other way around, okay? And you could teach your kids, your daughters to do it at an early
And we advise
age.
that this should be done after every menses.
Yes,
every month.
if possible.
Okay.
And other preventative measures for women who like to sunbathe overseas, here I see it's becoming a trend as well. Radiation, exposure to radiation. Women who quite often avoid breastfeeding, I highly would recommend that you breastfeed, because that takes away a lot of other issues that would also lead to breast cancer. Alcohol, the food you eat, and wearing the right garment would help improve the opportunities of us dealing with complications as well. Because I notice, I think about 99% of the time when I screen patients, I have to go through a whole school about the right breast
garments to wear.
That's a whole deal.
Thank you, Dr. Macauley. But I think, thank you for going through the self-breast exam with us. What we want to let viewers know is that when you do that exam every month, you then become aware of the contours of your breast. So you are in a better position to let your physician know
Exactly.
when there's an abnormality. That's the idea. Because I think women will be saying, well, what am I looking for? You're probably not even looking for anything in the initial stages, right?
Yeah.
You just want to be aware of how your breast
Yes,
is.
changes.
Yeah. Because, I mean, know the difference so that eventually when something goes wrong, you're able to better
Yeah.
report it. I think that's the
Yes,
point of it.
absolutely.
Okay. So now when we're talking about screening in general, what are the modalities when it comes to screening? So one is self-breast exam. What other things in general when we're talking about breast cancer
usually,
screening?
as I mentioned earlier, that it's usually seen in women 30 years and above, and even in Sierra Leone, places where facilities are available, women are 35 and above. It's advised that they undergo annual mammographic screening. And the
35 and
mammograph is just a specialized type of X-ray for the breast that can tell you whether there is any lesion there. But most, which is commonly available to us, is the self-breast examination.
Right.
And when you have a known history, first family relative with this breast disease, then it's also important that you actually see your doctor quite early. So he or she can advise you to have an ultrasound scan to be done to also detect the presence of any breast mass in your, any lesion in your breast.
Okay,
as
thank
early
you.
as possible.
So viewers, remember that you can call us on 025 271-959. We're going to open the phone lines and take a couple of questions before we continue. So the phone lines are open. You can call whenever you can, so you can join our discussion on breast cancer. Dr. Cummings-John, let's talk about staging. Obviously, if somebody has breast cancer, it doesn't mean, you know, it's the worst case scenario per se. There are different stages. So let's go through those.
Okay, so when we say stage, you know, want to know how far the disease has gone, whether the disease is it still within the breast or has it gone to other parts of the body.
Right.
Because by staging the disease, it also helps to guide the type of treatment the patient will receive.
Right.
Whether it's a surgery that will just remove the lump, or whether it will require surgery to remove the whole breast, or that it will require radiotherapy, chemotherapy, or as the case may be, or depending on what stage the disease is. So it's quite important for a patient that comes to you to know what stage the disease is. And we just look at the size of the tumor, whether there are lymph nodes involved, which the lymph node is basically the area where the breast cancer spreads to first, and then metastasis to see if it has gone to any other part of the body. So the importance of staging in our environment is to know which treatment we offer patients.
Okay, and then when you talk about metastasis, which is basically spread of this disease, which areas of the body is it more likely to spread to?
Okay, so quite commonly breast cancer can spread to the bones, the vertebrae, the backbones, and so patient will present with bone pain. They can also go to the lungs, where they can have difficulty breathing or chronic cough, persistent cough that doesn't go away. And they can also go to the liver. It can cause severe pain in the liver, and also jaundice, yellowness of the eyes, and distension of the abdomen if there is fluid collection as a result of the complication of the cancer. So it can also go to the brain. It can go to any part where the blood takes come from the breast, and can go to any part of the body. But it's quite important that when it's detected early, it doesn't have to get to that stage.
Exactly, that's
so
the
that's
point.
the important thing.
It
It doesn't mean
screening and early detection.
Yes.
So that it doesn't have to spread. Remember that you can call us on 025 271-959. We're going to continue a conversation with Dr. Thomas-Macauley. We're talking about palliation. Obviously, when we talked about stages, when it gets to stage 4, you know that you can't really do much when it comes to that. Then what is palliation, first of all, before we even talk about?
Palliation is the best possible way to manage a patient that you know they've gone to the worst level in their cancer diagnosis, and it's more or less in terms of making them as comfortable, pain-free as possible. It involves changing of wound dressing, managing of their medication, making sure that they take it regularly. It involves counseling. It involves basically getting as much support from both the medical team and family members, if available, in giving them adequate care so that the opportunity they have left, they are respected and morally able to cope with it
Okay. So we're gonna come back to you, but we have a call now. Caller, hello, good evening. Welcome to the Woman's Place. What's your name? Where are you calling from? Hello, good evening. Oh, okay. Sorry, I think we've lost that caller. We're going to continue with regards to palliation. Well, palliation, that end of life care. It's not only for the patient, I should say. It's also for that
the
care.
family.
Right. So it's important that we include them.
Yes. Hence the counseling part is highly necessary to involve people that deal with them on a daily basis, spouse, children, family members. If they have friend units or support group at the Well Woman Clinic, we do have a group that we have a group of staff that sometimes go out when they're in hospital or even after hospital to make sure that opportunity and that support from the clinic's aspect is there. Yeah.
Okay. So you also talk about survivors group, right? People who have survived breast cancer.
Yes.
What does that group do for them?
Oh, the group as support group, first of all,
sorry, we have a call coming in.
Sure.
Hello, caller. Welcome to the Woman's Place. Your name, where are you calling from?
Hello.
Yes, hello, good evening. Welcome.
Yeah, good evening. I'm happy to be part of this program.
Yes, welcome. What's your question?
I'm calling from Kenema. I'm Christiana Dakwan. It's
Wow.
really educative.
Yes, Kenema. Yeah, what's your question, Christiana?
Yeah, my question is, if you have a lump down your breast, how do you treat it?
How do you treat a breast lump? Is that the question?
Down
Okay.
very, very close to the breast, down.
Okay. One of our doctors will be able to answer that question. Thank you so much for calling.
Thank you, and I'm happy to see Constance Cummings-John, doctor. I'm so happy to see her. She was a classmate to me
Okay.
at the Annual Rich Memorial School.
Nice to hear from you.
All right, thank you, caller. So yeah, we were talking about the survivors. We're going to get back to the question soon. We were talking about survivors group and how important that is for those women who've survived breast cancer, especially when we talk about maybe surgery, if they've had like a mastectomy, removal of the breast. You know, in our society, the association with, breast and femininity.
Yeah.
So how does that survivors group help with regards to that psychosocial support?
The psychosocial support is a challenging one for even when you have the most amazing family people around you. One is, first of all, how the woman perceives herself.
Right,
Because
exactly.
she's already challenged health-wise, which means physically, psychologically, emotionally, every form of challenge takes place at the same time.
Right.
And if she has to deal with both the physical wellness and deal with all the other emotional people that come around to meet her, that alone takes a toll. And quite often that's where you see deterioration, because even the strongest woman has a lot that goes on in their head.
Exactly.
And it's not always easy for you to understand that if you're an outsider.
Right.
So
right.
we tend to have multiple approach, either through the closest sibling or relative that's around her. And also those members do need a lot of counseling,
Right.
because for them it's a whole...
It takes a toll.
It's a toll.
Yeah.
In many communities, as we understand, women that do come with some of the most terrible diagnoses for the first time, we see them quite often they're so late. Now it's a lot less because of the amount of word that's been put out there.
So there's awareness, and there's increase in awareness.
The awareness has helped a lot. But for a lot of these women going back into their communities, they're being banished from their villages, they've been cast out, they're called babu, devil, and that alone, we're limited as to how far we can get into their communities in helping that.
Right.
Hence, the radio program is very essential in helping us promote that awareness.
Thank you, Dr. Thomas-Macauley. We have a call. Caller, hello, good evening. Hello, good evening. I think we've lost that caller. Okay, we're going to go ahead. Also, we're talking about hello, caller. Good evening. Welcome to the Woman's Place. Okay, so we can't get that caller. But also when it comes to medication, some of these medications that we give women, it also basically sends them into early menopause. And when we're talking about femininity, that's also part of that psychosocial support. It's important that they know. You can have like as you say, a 30-year-old can have breast cancer, and depend on the type of breast cancer she has. And you say, okay, there's certain medication I give you, but then now all of a sudden she's, you know, having hot flashes and all the rest of it. So we have to make sure those are also taken into consideration as we deal with these patients. Dr. Cummings-John, okay, we have a call. Caller, hello, good evening. Welcome to the Woman's Place.
Hello, good evening.
Good evening, sir. Your name? Where are you
Hello,
calling
good
from?
evening. Hello.
Yes, good evening. Your name? Where are you
Hello.
calling? Good evening, sir. I don't think he can hear me.
Hello, who was it?
Okay, we're probably can you kindly call back? Okay, so we're going to continue. Talk about the oncology clinic at Connaught Hospital. When is it up? When is it run?
Okay. So the oncology clinic is a specialized clinic that sees mostly women with breast cancer or other benign disease, but we also see other women with other cancer-related diseases. And the head of the team is Professor Temidayo Ogundiron. He's a consultant oncologist.
Okay.
And he works at the Connaught Hospital and the Commerce at the College of Medicine and Allied Health Sciences. And myself, Dr. Isaac Olufemi Small, and other doctors, meaning house officers, medical officers,
So
are
the whole
also part
team.
of the team, yes,
Yeah.
with nurses as well. And so the clinic is operates on Fridays between 8 a.m. to 3 p.m. That you can even extend up to 5 p.m. depending on the caseload that we have. And it's mainly referral cases.
Okay.
So women that have actually been seen and screened in other facilities, like in other...
Just hold on kindly. We have a call.
Okay.
Caller, good evening. Welcome to the Woman's Place. Hello, good evening. Hello, good evening. Oh, okay, sorry, we've lost that one again, sorry.
We get referrals from everywhere. We get from Thinking Pink, from One Woman, in the provinces. We even had the patient come all the way from Liberia to seek oncology
So
care.
international patients
And she
in
had
Sierra
to
Leone.
go, and she has to come again in 2 weeks for her treatment.
Okay.
So basically, the care that we offer is holistic. It involves both surgery, depending on the stage. That will depend on the type of surgery we'll offer. We also offer chemotherapy, which are drugs that we give to treat the cancer cells.
Okay.
And then we also we also work closely with the palliative care unit,
team, yeah.
because there's a palliative care team at Connaught Hospital.
Okay.
And that's where mostly with women with advanced stage of their diseases, we work in conjunction with the palliative team. Yes.
Okay.
So it's basically a whole team approach consisting of doctors, nurses that see patients with breast-related conditions every Friday.
Thank you, Doctor.
It's actually a referral clinic, so it has to be a referral.
You have to be
for
referred
you
from somewhere else.
From somewhere for us to see you.
Okay.
Yeah.
Thank you, Dr. Cummings-John. Hello, caller. Good evening. Welcome to the Woman's Place. Good evening.
Hello.
Yes, good evening, sir. I don't think...
Hello.
Hello, good evening, sir. Okay, I think we've lost that caller. But Dr. Thomas-Macauley, tomorrow the Well Woman Clinic will be having a fundraising walk for breast cancer.
Yeah.
Tell us a bit about that.
This is something that we've been doing.
As I said, the clinic's been existing for about 13 years now, and we hold it once every year, same time, around any time in October.
Yeah.
And this particular one will be held at, we start from the Freetown Golf Club. We'll be there from 6:37 in the morning, and we'll be walking or riding all the way up the beach to raise awareness, to raise funds. So please, 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 please
Show up.
do show up. Get your t-shirts if you haven't got those yet. Just put on something pink, come and register and give your support, because we have so many women that needs this opportunity. For every woman that we need to be screened, we end up paying about $1,500,000.
So that's what the funds from this fundraiser will be used for?
Well, part of the funds is helping towards supporting those women who cannot afford it.
Right.
But also we've been trying hard to get our own mammogram machine,
Okay.
which is something that we really need. Like 10 years ago, we're struggling to raise that fund because it
costs a lot of money, and shipping it here as well costs a lot of money. And quite often from the money that we raise from our sponsored walk, we spend some of it back into the clinic. So it's not been helping us sustain that opportunity to get our own. And a lot of, let's say, 1 in every 2 women that comes in that's diagnosed with an abnormal mass or lesion basically needs a mammogram. So you do the math.
Yeah, you have to get money to be able to do that.
That alone is very costly, and not everybody can afford going to Ghana or Liberia
or Nigeria
to get it done.
That's good. So definitely we are trying to encourage people to show up tomorrow for the fundraising walk, so that more women be able to access quality management when it comes to breast cancer treatment. But I'm going to go through, we have about 5 minutes or so as we're waiting for calls. Yeah, we're going to go through some myths. I mean, we live in a society where people think, well, certain things when it comes to breast cancer. For example, we've mentioned family history as a risk factor. But does it mean if you don't have a family history of breast cancer, you won't have breast cancer?
No, it doesn't mean. In fact, for women who actually have a mutation in their gene, which is actually what guides cells that actually divide, in breast cancer, it only accounts for about 5%. So most women who do have breast cancer have absolutely no known family history whatsoever, and they still go on and develop breast cancer. So it doesn't necessarily have to be that way. You can still have breast cancer without a known family history.
That's a very good point. And also, Dr. Thomas-Macauley, you mentioned something with regards to lump. Now, again, women, there's a myth out there thinking if I don't have a lump, I don't have breast cancer. And you mentioned something, so just kindly go over that again, so that we know.
Every woman that starts, every young lady that starts having breast tissue, as we said, the screening is valuable. If you do not feel anything, as in a lump, but you feel some awkward sensation in your breast, whether it's itching, whether it's some pain that's persistent, whether it's redness, whether it's like a constant rash in an area, whether you just feel that there's a tingle feeling or burning sensation in an area that just wouldn't go away, please go visit a physician so that they can guide you and direct you in undergoing the right level of protocol for screening. Because if it's mismanaged and if you start applying things, and please do not apply do not apply anything, not the ori, not the contrimes, not the leaf, no creams.
Yes, okay. Thank you so much, Dr. Thomas-Macauley. I'm going to give you a last word because she's kind of summarized it quite nicely, and also give an answer to the lady who called from Kenema with regards to the lump in the breast.
Okay, so if you have detected a lump in your breast, it's quite imperative that you seek medical attention as early as possible, because we do see women who come to the clinic with advanced stage of their disease, and they just assume it's just quite normal, and it's not normal. If you see something that wasn't there, you seek medical treatment as early as possible, because we've had cases of women who've undergone surgery, they've undergone drugs, and they're doing fine. We're following them up on 3 months, 6 months, a year, and so far they haven't had any evidence of disease recurrence. So the final and closing word is that early detection is key for breast cancer, and with early detection, there is a chance of you being treated and having a very prolonged
lifespan. Thank you so much. Viewers, this has been the Woman's Place show. We have spent the hour discussing breast cancer with regards to its symptoms, diagnosis, and management options in Sierra Leone. I'd like to thank my panelists, Dr. Constance Cummings-John, a specialist surgeon at Connaught Hospital, and also Dr. S.A. Thomas-Macauley, medical director at the Well Woman Clinic. I'd also like to acknowledge the work that Connaught Hospital Oncology Clinic is doing, as well as what Well Woman Clinic is doing with regards to breast cancer patients. I hope you'll all be at the Golf Club tomorrow at 7:30 a.m. to support the Well Woman Clinic breast cancer fundraising walk. I'm sure we've all known someone who has been affected by this dreadful disease. So we basically can do whatever little we can to support, and that little can go a long way with regards to helping others who are suffering from this condition. I'd like to thank my team here at AYV. Thank you, viewers, again for watching and supporting the show. Thanks to IK Designs for floral arrangements you see there with Breast Cancer Awareness Month. Till next week, I've been your host, Dr. Frances Ramatowori Sise, wishing you all a happy and healthy weekend.
You're watching AYV Television.